So some patients that have the tumors that keep moving all the times, that keep moving in each fractions. In the past, we cannot treat this group of patients, but nowadays we have the MR Linac. It's allow us to see the lesions. It's guarantee us that we won't miss the lesions anymore. We can treat this kind of cancer patients.
So Siriraj have very put the priority on this transcatheter valve. We are first hospital in Thailand that operate this technology back in 2009, and we know that a lot of patients need this operation and that save their life. So we put this as a priority.
I think we can adopt all the operation into this machine easily because of the magnification and thermal cancelling out. That can improve the operation very good. So I think the future has come, and the operation of this kind will replace all the all-day open surgery. Siriraj Hospital is the leading hospital in Thailand, and we are very much focused on the new technologies in the world. Once we have been found that this technology is the best in the world and the state of the art in the world, we will bring to the country and then try the new technology in our patients. Well, for the preciseness of the surgery, we can have a better magnification and better visualization during the operation because of the camera that we put inside the patient's abdominal cavity. That can prevent the traumatic injuries to other organs of the patients. For instance, we can preserve the nerve well, so after surgery, the patient have gain recovery very fast. These technologies been using the pressure inside the abdominal wall, so the breathing is much less. So patient will be getting the recovery period very short. So in other words, they can go back to work very fast, and also they have less pain after surgery because we have, and with this kind of technology, patient will be much less discomfort after the surgery. With the pressure inside the abdominal cavity, thoracic cavity, the patient will have less blood loss. Don't need to have a transfusion afterwards. So that can improve a lot in terms of the recovery and also the health well-being after surgery. Most of the time we use the equipment for the prostate surgery, so we can preserve the organ nearby very well, including the nerve that control the function of the erection function and also continence function afterward. There are a lot of operations that we can do using this kind of machine. So in other words, I think there will be much further developed in terms of the quality of the treatment. So nearly every kind of surgery can be done using the robotic approach.
Because we want to treat all kinds of cancers. Siriraj Hospital is treat cancer patients up to 3,000 patients per year. So some patients that have the tumors that keep moving all the times, that keep moving in each fractions. In the past, we cannot treat this group of patients, but nowadays we have the MR Linac. It's allow us to see the lesions. It's guarantee us that we won't miss the lesions anymore. We can treat this kind of cancer patients. It's the main reasons why our hospital set the bar so high, because we want to give the Thai people to receive the best cancer treatments. That's why we pick the most advanced radiation machines in our hospitals. So the MR Linac give us the confidence. So with that confidence, we can reduce the margins of the radiation areas. Because we can see what we actually treat in that days, we can reduce the margins of the radiation fields. With the strict margins, we can intensify the dose in each fractions. We can decrease the total treatment times. The patients come to hospital much less than in the past. It also means it's much less toxicity than before because we can reduce the margin, right? So that the adjacent organ will receive less radiation dose. That's the main reason that we use MR Linac to treat the moving cancers in almost all patients right now in our hospitals.
In the past, we identified that they have some challenging anatomy that may be difficult for this technology because we have put this in parity. So now in the difficult case, difficult anatomy that may not be candidate, and in the past we had to turn them down, and we can do it with a good outcome, with excellent outcome. So Siriraj have very put the parity on this transcatheter valve. We are first hospital in Thailand that operate this technology back in 2009, and we know that a lot of patients need this operation and that save their life, so we put this as a priority. And I think this year we have the number of the operation to be number one in the Thailand and also in the level of Southeast Asia.
And rather than that, we will have even the new technology in terms of the surgery, interventional cardiology, navigation, neurology system that we've been using for treat our patients, and in the last few decades.
We also have the smart EMS cars that we transform our ambulance into the smart ones. So it's allows us to send the vital sign real time to the emergency rooms. So the doctor at the emergency room will know the vital sign of the patients and prepare the tool before the patient arrive at the emergency rooms.
We have the good outcome in terms of operative mortality, less than one, only like 0.8%, and 1 year mortality is like less than 10%. And we put all the effort to help the patient.